Welcome to You and Your Pet. I'm Jim Horton, and we're here with our resident expert, Dr. Ernest Rogers of the Maplewood Animal Hospital, and we talk about a wide range of pet issues. And tonight we have a special guest, and I'm going to ask you, Dr. Rogers, to introduce him to us.
Thank you very much, Mr. Horton. I would like to introduce Dr. Ian Spiegel, who is a dermatologist, and he works at several New Jersey hospitals, including Garden State Veterinary Specialists and Emerge. And I think he also is at another hospital in PA, Veterinary
Specialty and Emergency Center.
Specialty and Emergency Center. And I have to say I have a lot of respect for this gentleman because when I was in school, dermatology was sort of like radiology. Everyone else saw it, but I didn't. And so when we get cases with skin diseases, often we try a couple of things, then we're forced to send to a dermatologist who then figures it out. And so Dr. Spiegel is in a very unique profession and doing a very unique job, very unique specialty. So,
Thank you. Well, let's start off by asking you, what is your background? How does one get into veterinary dermatology?
That's a good question because it's a very small specialty. In the whole country, there's less than 250.
Is that right?
Specializing in dermatology. I actually became interested from growing up with a dog, a Labrador, who had a lot of skin problems. And so I could see how frustrating it was for myself and my family. And I just figured, well, this is really interesting. So I even knew by the time I got to veterinary school from the day one that that was really what I wanted to do, which is kind of odd. Because usually you sort of figure out what you want to do when you're going through school, but I pretty much knew from the beginning. So.
But you didn't start off to be a veterinarian, is that correct? You started off in another direction and you decided to go into veterinary medicine later?
Well, I always had an interest in medicine, so I wasn't sure if it was going to be veterinary or human. And so when I came to, I was an undergrad and I'm kind of like, well, what am I going to do now? And so I actually went into public health school and I did a master's program in public health. And what I actually did was a dog bite prevention program. So I actually worked with children and educating them about dog bite prevention. And then I applied to veterinary school and got in, and there it was.
There it is. So, well, congratulations.
Yeah,
you traveled, I think before the show, you mentioned that you were in a number of places before you completed your degree. And since it is such a subspecialty, did you have a lot of choice of where you could go to study it?
No, actually, on average, there's actually about 5 positions a year total for residencies, which is really kind of tough on veterinarians or veterinary students who want to go on and specialize, especially in dermatology, because it's probably one of the smallest specialties there are, which means there's less residencies available. And actually, after my veterinary school education at University of Pennsylvania, I did an internship, which is pretty much required for any sort of residency. So after that, you go to an internship, and I did that at Cornell. And then I actually did go, like you said, across the country to UC Davis, which was a great experience out there. Completed my dermatology residency, and then we take an exam just like all of the other board specialties. And you have to do more than that. It's writing papers and doing case reports and all sorts of things like that. But then after that, I migrated back to the East Coast, so here I am.
And it should be noted that residencies are not easy 3, 4, or 5-year programs. They're very difficult. Right. There's a lot of learning that goes along with the saying that they gave me when I was in residency: see one, do one, teach one.
Right.
So any procedure you see, you got to be able to teach and do. So
sure.
Again, the residency is a tough place to be.
Yeah.
Well, since it's such a small specialty, then you had to almost find the few other senior veterinarians who actually were doing dermatology. That's basically what the challenge was, right?
Yeah, you have to sort of seek out, if you're really interested even through vet school, when you knew you were interested in a certain specialty, you would kind of migrate towards the faculty members, and they would sort of become your mentors. And that even lasted through my internship. You kind of migrate to the dermatologist there. And then your true mentors would be your, who trained you during your residency, who are typically, veterinarians who have been doing this for quite some time and have a lot of experience, and that's who, trains you usually.
What are the broad ranges? I mean, obviously we're talking about skin diseases,
Sure.
but what are the broad ranges of skin conditions that we're talking about? Is it as broad as human dermatology problems, or is it more restricted? Are we talking about dozens of diseases or tens or hundreds?
Yeah.
What is it we're dealing with?
Millions.
Yeah, right.
Millions?
I think that there is a lot of crossover, but at the same time, there's a lot of things that don't necessarily correlate with the human side. One thing I think that really sets us apart on a number of levels is, number one, we're not just dermatology. We actually do a lot of allergy. Because in veterinary medicine, specifically, dogs, cats, horses, the way they present with allergic disease is usually through skin disease, whereas in humans, a lot of the allergic diseases are more what people are familiar with, like an ENT, where they would deal with rhinitis, sinusitis, sinus infections, and so forth. That's a lot different in the veterinary side. We're more so dealing with recurrent infections, and the skin plays a major role. Also, ear infections and things like that. So we have a very broad range. And the other thing is we're treating multiple species.
Right.
So it's not just one, and not all species are alike. Systems are similar, but they all get slightly different types of diseases.
So when you say multiple species, obviously dogs and cats, but are you
Absolutely.
doing large animals as well?
So during the residency training for veterinary dermatology, we are expected to understand, be able to, and practice on equine, so horses, ruminants, sheep, goats, etc.
Wow.
Even poultry and exotics.
Oh, no kidding.
Yeah. So it's quite an exam that we get to take.
Yes.
But by far, the focus is dogs and cats. But we definitely are expected, just similar to ophthalmologists. Skin, I think, in ophthalmology, dermatology, ophthalmology, even probably cardiology, we kind of go across all species. So we're really specializing, in a lot of different areas.
I
So
think
in-
most veterinary species do
Yeah.
cross all species.
Right.
But then people tend to say, well, I'm going to be mostly small animal or mostly large animal.
Sure.
But I know even in my education as a veterinarian, we did discuss dermatology of reptiles, how the skin heals,
Sure.
and skin
Yeah.
healing and skin diseases. And reptiles have a lot of skin diseases. So
Sure. Yeah.
So in your practice now, do you ever get exotics and
Yeah.
with very strange kinds of conditions that you've not seen before?
On occasion, we'll get some consultations on exotics and relating to dermatology. I would say that another thing that probably sets us apart from the human side is a lot of our skin diseases stem from parasitic diseases. So that could be fleas, which most people are familiar with because they've probably seen them at some point, but also things that are microscopic that aren't seen, such as mites and lice. And well, you can sometimes see lice, but especially mites. And that's not really dealt with as much on the human side, but for us, especially in exotics, because you bring that up, a lot of times it is a parasite that's actually causing the skin disease. And so by diagnosing that and treating it, oftentimes we'll resolve the skin problem.
So let's move on to the diagnosis and the treatment. What are some of the basic techniques that you use? You get an animal that comes
Yeah.
in, the animal presents some sort of condition. What is it primarily pills, or is it salves, or what is it that you're doing to cure
It's
it?
a good question. So when a patient presents to us, usually obviously the owner or companion comes with them, and we often will have them complete a very extensive questionnaire.
Is that
and
right?
I know it seems like a pain to the clients, but really very important for us is history. And that's important across the board in medicine in general, but in dermatology especially, because your list of what this could be really depends on, did it just happen last week, or has it been going on for 10 years? Are there other pets at home that have a similar condition? Are there family members, human family members, who have similar problems? Because some things are zoonotic, which means can cross from human or from dog to human. And so that certainly is very important. And we as veterinarians obviously play a role in protecting humans as well. So getting all of that history is important. And I would say the history and then physical, just looking at the patient. I know one of the things that's always talked about by general practitioners or even veterinary students is everything looks the same. And it's true. And it's sort of, I think, frustrating for veterinarians and students. They look at us like, we'll do a lecture, a CE lecture as veterinary dermatologists, and by the time you're done sitting through 3 hours, you think the first slide and the last slide are the same disease.
they usually are.
And they are. No. So I think that is frustrating, but as you do this longer and longer, your eye really does become trained. And interestingly enough, even my own nurses who work with me, who have been working with me for 8 years, they actually, at this point, just from doing it so frequently, will go into an exam room, come out and say, it's X, Y, or Z. And it's just from that seeing the same
Right.
things over and over again. And quite frankly, That's what sets apart a specialist from a generalist.
Right.
You know, a generalist is a specialist across the board. I mean, I couldn't even begin to try to manage, heart disease, because I just haven't done that in years. Whereas a general practitioner has to manage heart disease, lung disease, orthopedics, everything, and I don't envy that at all. But
I think we do have to point out that dermatology has its basis in internal medicine. So even though
Absolutely.
one is a dermatologist, one must be familiar with internal medicine, parasitology, pathology,
Yes.
most of the ologies physiology, most of the ologies that we have to deal with is veterinary medicine. So I don't want the public to have a feeling that a dermatologist only deals with skin. I mean, we don't get that specialized. It's not.
And actually, interestingly enough, a lot of diseases start from the outside and are an indicator of what's going on the inside. So a lot of different endocrine or metabolic diseases, internal diseases, even internal cancer, we pick up on as veterinary dermatologists because a lot of diseases, the fancy term for that is paraneoplastic syndromes, is that there's something going on internally, but it's reflected externally on the outside. And a lot of times, the veterinary dermatologist is the first to pick up on something and really sort of say, okay, well, you need to go to internal medicine or get some blood work done, or you need an ultrasound or an x-ray or oncology. So
all of your work is by referral, right? I mean, it's referral from practicing general
Yes.
Veterinarians. Is that correct?
So the majority,
someone can't call you up and say, "I want to bring my pet to you."
well, there are some who do eventually find us, but majority of the cases we rely on general practitioners spreading the word. But as more and more outlets are available online, I think that clients are sort of figuring out on their own, I've seen this particular specialist and they work at this particular hospital. They just get online and punch in, conditions or signs just like they do for humans now.
Right.
And you find a doctor, for instance, who is a dermatologist. But generally, we really rely on a very cohesive relationship with the general practitioner because they'll help manage the cases long-term along with us.
And I think that's why we have the show,
Yeah.
so that people out there can see that it's not all me.
It's
a team approach
Absolutely.
with the specialist who comes in and takes over the cases when
Sure.
we're over our head or underwater.
And the other thing I just want to point out too, because you asked this question earlier, is what kind of diagnostics do we do? And a lot of them are very non-invasive. So the simplest thing, like taking a piece of Scotch tape, touching it to the skin, putting it in stain and looking at it under a microscope can give us a lot of information. And that's as simple as that. And we also do biopsies. We do scans like CT scans, CAT scans. We do things under anesthesia like cleaning out the ears with endoscopes and so forth. So there's a lot of different things we do.
We've run out of time in our first section. We'll be right back with you and your pet.
Television is a powerful and influential medium that allows different groups the opportunity to produce programming that directly affects their own communities. Public, educational, and government access channels ensure that all people, regardless of race, age, gender, disability, religion, or economic status, have access to local government information and the use of a public communication forum. Make sure everyone has a voice. Support your local PEG channels.
Welcome back to You and Your Pet. I'm Jim Horton, and we're here with our resident expert, Dr. Ernest Rogers, and our special guest, Dr. Spiegel, and we're talking about dermatology. And I'd like to turn now, if we can, to individual cases. Is that not correct, Dr.
Yes,
Rogers?
I think we've given people a good background of Dr. Spiegel's education and expertise, and I think maybe we can show a couple of common cases that people might appreciate. And I think we'll, first just let me ask Dr. Spiegel this one question. Please just, and very briefly, tell me about the one emergency that dermatologists have. A lot of people want to become dermatologists because there are no emergencies.
Well,
So
there's emergencies, and then, an emergency often will be what a client feels is an emergency.
Right.
And there's a couple things that clients don't appreciate, and that's a very strong malodor in their house or staying up all night from itching. So those are client emergencies. But in reality, there's not many derm emergencies, which is one very nice piece of what I do. And we always kind of joke, if an emergency practitioner can't figure it out and corticosteroids don't treat it, then it's probably something we wouldn't have been able to save at that point. But there are a couple reactions that occur acute or quickly, and oftentimes there'll be something like a drug reaction. which is actually oftentimes a serious condition, just like in people.
Right.
And luckily, those are very far and few between, but on occasion, that will occur. And some of the worst derm emergencies, it's so severe that really there's not much we can do, but luckily, it's extremely rare.
Right.
So most of what we do is very treatable.
Right. And so it's not something the average person has to worry about.
No,
Okay.
they'll probably not experience that.
Not experienced. So I think we have a couple of cases here
Sure.
today, and one of the ones that seems to me to be a real common one is a food allergy. I see it a
Sure.
lot in dogs. I've seen it occasionally in cats. But I think this surrounds the history, as you pointed out, is
Sure.
very important, because I've seen dogs eating out of plastic bowls that have all kinds of allergies around their face from the
Sure.
plastic bowls, not from the
Sure.
food. So it's quite a differentiation. But here we have a cat. This is our first picture of a food allergy. And the cat has quite a bit of debris in the air, but also looks like as if it's been scratching itself.
Sure.
So if I looked at this, I would probably say air mites, but it's a food allergy. And
Well,
so why do we have this excoriation? And
So one of the things I would say is what's important is it could be ear mites, it could be food allergies, it could be environmental allergies, it could be fleas. And I think that when a patient like that presents to us in dermatology, we have to get the whole picture, and before we actually jump on food, we rule other things out first.
Right.
Because we can manage the infection, make sure it's not mites, make sure there's not even ringworm, which most people are familiar with. Because all of those things can do this, but then we back our way into, is this food allergies, or is this environmental allergies like grasses and trees and weeds and things like that, or is it multiple things? And sometimes if you manage multiple things, you'll be able to control that patient, whereas if you just change the diet, it may not actually get you where you're trying to get to.
So, I mean, before we move on, you piqued my interest here because you said you have to rule out various things.
Absolutely.
How, if the owner maintains there's never been a flea in my house,
Sure.
Can you really believe that?
Yeah, that's a tough sell, and a lot of dermatologists we kind of agree with that. A very common disease the clients have is flea-nial, which is denial that there's fleas. And it's very hard to discuss fleas because people assume that we think they're dirty,
Right.
which
Uh-huh.
is not the case.
Right.
And the other thing, especially in cats, is they're such excellent groomers that they will remove the evidence before we see it.
Uh-huh.
But we still have to suspect it as a potential cause. And so if this patient presented to me, somehow before the end of that consultation with this client, I am going to talk them into doing some sort of parasitic control, because that's a quick fix. Whereas food allergies or even environmental allergies is chronic.
And I think we have some pictures of fleas
Right.
in the next segment. But now going on to the second picture, that is another cat with food allergy, but that could be anything. But again, has all kinds of pretty bad lesions. It's around the mouth and face.
Sure.
And again, this is a case of a food allergy where
Sure.
the animal's skin gets itchy.
So a lot of this also comes back to the more cases you see, the more you understand what's going on. And one of the things we'll see, especially in cats with food allergies, is they'll have a lot of their sores located on the face and also on the hind end area, but specifically the face. And in dogs, it's similar, but also the feet will be involved. Whereas some of the other diseases we talk about, or hopefully can get to some of them, it's different patterns. So a lot of it is pattern recognition. And that's what I mean. The more cases you see, the more you understand and can figure things
Exactly.
out. So, but this is typical, the excoriations on the face for food allergies in cats.
Okay.
And so our third picture is what I've called a rodent ulcer. And many of my clients call them rodent ulcers, or actually an indolent ulcer. And it's actually on the upper lip, and looks like as if it's thickening of the lip with some secondary tissue.
Yeah.
And so that is also related to a food ulcer, but
So-
could be related to other things.
So indolent ulcers are part of a disease complex often called, and I'll explain it, but eosinophilic granuloma complex. And eosinophil is a type of blood cell, a white blood cell, which is very common in either parasitic disease or allergic disease. And in cats, they'll often present with different sorts of presentations with that disease, one of which is ulcers in the mouth. And when that comes to us, when that presents to a dermatologist, we will rule out things like flea allergy, even though you wouldn't think fleas would do that, but food and then environmental. They also tend to be actually very responsive to antibiotics as well, or antimicrobials. But certainly that would be things we would do. And then as far as food allergies go, I know, and I kind of want to throw this out there because I think a misconception to the public is that they need to feed a grain-free diet. You know, it's the corn, it's the soy, it's the wheat, and actually those do play a role in food allergies, but more often than not, it would be along the lines of a meat or a protein source.
Oh, is
like
that right?
Fish or chicken, and sometimes, you know, soy or dairy and things like that.
Dairy,
So
potatoes, rice.
right. So you might be doing a grain-free diet, but if you're feeding fish as well, especially in cats,
Right.
that might be actually the culprit.
Right,
So
right.
it's
And-
important.
That
And
I
it's
didn't know.
difficult. It's difficult from my perspective as a generalist. Someone comes into me and I say, this is a food allergy, and I've diagnosed food allergies on my own.
Right.
And I say, look, we got to go with a trial on a food that has nothing in it. It's all the allergenic properties have been removed. And they say, well, you know, I found this food that doesn't have rice, so I switched from what you asked me to do to something else, and he's doing a lot better. And then 6 weeks later, he's doing bad again because we have never eliminated the process. And so
Right.
we do food elimination trials to
Okay.
find out what this is. And that's very difficult because a lot of times people have kids and the kids will throw them things, or they just don't want to do
Right.
this trial for 10 weeks. But that's one of the ways we eliminate food allergies.
That's the same way in humans,
Yeah,
then.
yeah. And
Yes.
the other thing too, especially, is that, like I said, there's often multiple things going on, and
Right.
they may have improved because it's the middle of the winter, and they
Right.
would have improved on
Right.
any food we
Right.
gave them. But
Right.
come spring, and they're flared up, and so that really does indicate that environmental allergies are playing a role.
So then just moving on to our fourth picture, this is a dog with what could be food allergies, could be conjunctivitis sicca or a
Right.
dry eye. It
Right.
could be anything, but
Could be.
you're telling me that it's food
Yes.
allergies, so I
there's-
believe you.
Right. There's periocular dermatitis around
So
the eyes.
around the
and
eye,
So, and there's
there's
facial. It's kind
swelling.
of cut out there around the lip folds as well. But this could be, like you said, any sort of disease. We would also rule out mites in this case, or rule out, actually sometimes in a patient like this, if they're getting eye drops, they can have secondary irritation around the eye
Right.
from the eye
From
drops.
the eye drops.
That's where the history becomes very
Right.
important, because changing the drops and addressing the secondary
Right.
infection can resolve the entire problem. But that's where history is important.
Also knowing the environment
Absolutely.
and knowing what's changed in the house and
And when did this start? Was it a seasonal? Was it in the middle of the winter? Was it
Right.
the spring, and so forth?
Are owners that sensitive that they really do recall all the individual things that you need to know in the history? I mean, if I take our pet at home and you started asking me questions about him, I'm afraid that I would not be very intelligent in my answers.
Well, one of the things that we do rely on as well, and this is where the general practitioner plays a big role, is we obtain their records usually prior to the patient coming in.
Okay.
So a lot of times that means reading through 20 or 30 pages of records before we even enter the room. So we have the client doing a questionnaire, we have the referring veterinarian or veterinarians giving us information. We go in and then do our physical and quiz the owner. And with all of that information, you can really figure out what's going on. And yeah, sometimes the clients really don't know much of what's going on, but luckily with everything else and enough experience, you're usually able to really figure out what's going on, because you do have some clients who will think, well, it just happened, but really just happened has been 5 years.
right.
Uh-huh.
And it's nice to have the
Yeah.
entire family there because what one person has noticed, I've had families get into arguments when giving a history because one person has noticed something that another person hasn't. And again, it's resolving all the issues surrounding this, not only the physiological, but the environmental, the historical, and the pet issues themselves
Right.
that you're bringing together. So this little dog is food allergy. I believe you, Dr. Spiegel.
Thank you.
So we go on to the next segment, and this is one of the biggest things that I have a hard time dealing with, convincing people, as you said, that they have fleas.
Sure.
And one of the problems is that, as you said, they think that we're saying that they're dirty, or they don't take care of their dog, or the dog isn't a healthy dog.
Sure.
And that's furthest from the truth. You can't stop fleas; they're all over. And particularly this year, we're going to have a bad flea and tick
Absolutely.
season.
Yep.
And so when animals come in with what appears to me to be flea and tick, people are really resistant to use appropriate flea and tick control.
Sure.
And so this is what a flea looks like. And quite frankly, when I've seen them, there's a black dot, and when you go closer, it's disappeared because it's jumped 2 feet or 3 feet in the other direction.
And inevitably, according to the client, that happened in the waiting room.
It
There's
did.
no-
It did. It did. Picked it up from the dog that was sitting beside me. And so if we move on to the
But
next.
this didn't happen in the waiting room.
This didn't happen in the waiting room. So when you get something called a flea comb, and you comb the fur, this is what you get. Dr. Spiegel, could you describe what this is?
So this is a simple technique, as I mentioned, non-invasive. You comb out the patient, put it on a white paper towel, and drop water on it, and smear it, and you'll see all of that red there is actually blood, because fleas live on blood, and so their fecal material is basically dried up blood. And so you can really show that it'll smear, and that's when you know there's actually fleas. Whether the client believes you or not, that is living proof that that's what's going on. But as far as managing the flea allergy, I think that, first is getting people to realize that's playing a role, and then discussing the different products that we have. And the market is inundated with products. And it's not so much what the product is, it's how you use it as well. Because some people, they'll say they're giving flea control, but they're doing it to one of the 7 cats at home, or they're applying it twice a year, or so forth. And so, or the dog is swimming constantly, and if they're swimming constantly, it doesn't matter what topical you're using. Eventually, some of it's going to be washed off, and then there's lack of efficacy.
We're getting pretty close to running short on time, so I would like to ask at this point, if there's one key point or series of messages you want to leave with the viewers, what would those be?
As far as dermatology?
Yes, as far as dermatology and pets.
I think it's like many other medical conditions, both in humans and in animals. The earlier you seek care, the earlier it is to manage the problem. Because one of the issues we get as the dermatologist, the specialist, is we get them after they've been chronically affected. And so it's much harder to bring them back to a normal state. For instance, especially with ear disease. I mean, ear disease can be very easy to manage, but if it's been going on chronically, it can get to the point where it becomes surgical and an ear canal needs to be removed. And that's pretty traumatic for a lot of owners.
Very painful.
Okay.
And it's preventable. And that's sort of an example of, see your veterinarian. If it doesn't make sense, so they're not getting better, go to the next stage, and then if not, maybe ask for a referral or talk to the dermatologist. Yeah, exactly.
So see your veterinarian first. Okay.
Yeah.
Thank you very, very much. We've been talking with Dr. Ian Spiegel, with our resident expert, Dr. Ernest Rogers, and this has been You and Your Pet. I'm Jim Horton. Thank you very, very much for watching.